Very good evening and namaste to one and all. Myself, Dr. Manisha Rana. I welcome you all in the 113 series, Gyan Ganga Knowledge Series, Knowledge Webinar. I welcome all the respected Gurujans, all the participants who have joined us live from the different parts of the country, and Professor Dr. Maya Gokhale ma'am, who is stalwart speaker for the day, and all the live viewers and students. Well, once again, welcome to 113 webinar series, Gyan Ganga Knowledge Bridge. Before commencing the session, I would like to pay sincere gratitude to respected Padma Bhushan Vaidya Shri Devendra Tribhunaji sir, governing body RAV, respected Vaidya Manoj Nesri ji sir, advisor Ayurveda, Ministry of Ayush, respected Director Dr. Kaustubh Upadhyay sir, Director RAV and advisor Ministry of Ayush for their constant support and guidance. For today's session, we have excellent speaker, Professor Dr. Maya Gokhale ma'am with us. She has completed her MD from Tilak Ayurveda Mahavidyalaya, Pune, and PhD from BST DDS Ayurveda College and Research Institute, Wagholi, Pune. Ma'am has also gained master's degree in Sanskrit from TMP Deemed University, Sadashiv Peth, Pune. In the field of teaching, ma'am has more than 2 decades of experience. She has remained as a lecturer from 2001 to 2007 at College of Ayurveda and Research Center, Pune. She has joined SSA College, Hadapsar, Pune as reader in year 2007 to 2013. Later, she became professor in the same institution from 2013 to till date. In the field of education, ma'am has remained PG guide and research guide in Panchakarma. She is HOD Panchakarma department. Other than all these achievements, ma'am has completed NABH as Ayush Assessor course with observership in 2021. She has also completed Samvahana basic and advanced level course in year 2018 to 2021. The other achievements are she has 25 scientific publications under her name. Ma'am has attended more than 25 CMEs, workshops, seminars as resource person. She has delivered more than 30 lectures on Ayurveda. She has received various awards, which are Ma'am has received a Ranaragini Award for her female practitionership. She has received Best Paper Award. She has also won the Best Article Award in scientific Ayurveda journals. She has other achievements as well, but because of shortage of time, I'm not able to name all them here. So I request ma'am to enlighten all the participants on the provided topic, diagnosis and treatment protocol for Shodhana Chikitsa in Vandyatva. Ma'am, I wholeheartedly welcome you because this session is running live all across the country. People are watching us live. So I request you to enlighten all the participants with your thoughtful words. Welcome, ma'am. Welcome on behalf of entire team of RAV.
Thank you. Thank you very much, madam. And I am really thankful to RAV and Ministry of Ayush and all stalwart directors of Ayush for giving me chance for participation in this Jnana Ganga Vahini. So I am going to share my views about this protocol on Vandyatva.
It's visible, ma'am.
Yes, thank you. Yes, now I go into slide
Yes, ma'am. It's
show
on
more.
slide 1.
Yes. Yeah, is it visible?
Yes, ma'am, it is.
Okay. So, good afternoon, everyone. My topic today is diagnosis and treatment protocol for Shodhan Chikitsa in Vandyatva with special reference to female infertility. Nowadays, 8% to 9% of couples suffer from infertility. They nowadays also consult other pathies and integration of treatments is also there, a new trend. For infertility and also for Supraja, patients are looking forward to Ayurveda. And nowadays, many infertility Ayurvedic centers are running successfully all over the world, I must say. But when we are treating this infertility, we have to take some common things, that is the basic and important principles of Ayurveda, into considerations. So my objectives of today's lecture are: it is seen that there is a lot of variation in drugs and Shodhana Chikitsa administered for treating Vandyatva. Different people are doing, different Vaidyas are doing different treatments. But Ayurveda principles on the basis of which the treatments are administered has to be uniform. So here is a stepwise treatment protocol for Vandyatva Chikitsa with special reference to female infertility for administrating Shodhana. So this is my objective today. After this lecture, you all should be able to form your own protocols based on Ayurvedic principles and successfully treat the infertility, and even these principles may help you to practice Ayurveda successfully on basis of basic principles. So in Ayurveda, for successful treating any case, first Nidan Panchak study is most important. Nidan has to be done. After that, the proper treatment can be administered. So for successfully treating any case, Nidan Panchak study, whenever patients come to us, a proper history should be taken and diagnosis should be proper. So for this, we are going to look about this background, or taking a review of what we need to study for Nidan Panchak. So on basis of dosha, Charak Samhita has emphasis the doshas. As we all know that in Yoni Vyapada Adhyay, Charakacharya has explained Vata Pradhana Yoni Rog as 11 number, Pitta Pradhana Yoni Rog 3, Kapha Pradhana Yoni Rog 1. In Charak Samhita Yoni Vyapat Chikitsa chapter 20, Yoni Rogas are explained. The gynecological practice in Ayurveda is based on this adhyay widely. So this is the base from Charak Samhita. Now in background we will see the Sushrut Shari. So for infertility, how the fetus is formed, according to the Sushrut Samhita, the conception occurs based on four main factors. And we have to consider these factors also. As Sushrutacharya has quoted, Dhruvam Chaturnaam Sanidhyat Garbhasyat Vidipurvakaha Rutukshetrambu Bijanam Sanidhyat Ankuro Yatha. These four factors are also important to find exact Hetu and Samprapti. They also help us. That is Rutu, Kshetra, Ambu and Bija. To take a review, where Rutu is fertile period, Kshetra is uterus and reproductive organs, and Ardhavava Srotas. That is Travarta Yoni is considered as Kshetra. Ambu we can say is Rasa, Rakta and Drava Dhatu, providing nutrition to this Ardhavava Srotas. Bija is Shonita or ovum in females. Any abnormality in these factors may also cause infertility. So we have to study this Rutukshetra Ambu Bija while taking history is most important. So this is the another four factorial consideration while treating the infertility. Let us move further. Now, importance of Vata dosha. Vata dosha is most predominant as Pitta Pangu, Kapha Pangu, Pangavo Maladatava. We all are aware of this since first year. The predominance in the pathogenesis of Yoni Roga, the Charakacharya has also said, Nahi Vata Drute Yoni Narinam Sampradushati. This is a famous quote for treating all the Yoni Vyapats. So, Vata consideration is most important. Now, what we have to study is how the types of Vata are dominating the Rutu, Kshetra, Ambu and Bija. In this slide, we can see the predominance by types of Vata. Rutu or Kshetra, that is cycle, and the anatomical structure, that is Garbhashay, they are dominated by Pranavayu, Vyanavayu and Apanavayu. How that Vyuhana or formation is led by Pranavayu, as Prana is the god of Murdhasthana, we can say, and he is all hormonal levels and all the brainy or CNS system is governed by Pranavayu. In case of female structures, all thyroid glands and pituitary, everything is dharana, is pranavayu. So the vyuhana or formation of bija is governed, the cycle is all by pranavayu. So Vyanavayu comes in the picture, is responsible for circulating and providing rasa and rakta and drava nutrition to these areas. And Apanavayu comes in where the Rajas Rav and rupturing of the follicle comes in. So all these three Vayus are predominating Rutu and Kshetra. In case of Ambu, Ambu is again nutrition. When Samana Vayu does its Agni Sandushan properly, the Ambu or Rasa is formed well and the nutrition is given to these female reproductive organs, and the circulation is dependent upon Vyana. So Saman is helping Agni and Vyana for circulation. Now let us consider the Bija. So formation of Bija is again dependent on Pranavayu, circulation Vyanavayu, and Apanavayu for rupture of follicle and Rajasrava. So this is the role of types of Vayu in the anatomical structure or anatomy and physiology of female reproductory organs, which we have to consider while taking the case of a infertility patient. Then we further move to the Srotodrushti, which Srotas we have to examine very well. So Artavavaha Srotas is the basic Srotas, and according to the Charak Samhita, it should be considered that Srotodushti is of four types. What is it? Ati prarutti sangova siranam granthayopicha and vimarga gamana. So, what is the ati pravrutti in case of arthava srotas? It is maybe like diseases pradara. So, for pradara, arthava dushti is there, rasa dushti may be there, and raktava srotas dushti may be there. Then, what is the sangha lakshana? Alpartava or kashtartava may be considered in this sangha type of dushti, where arthava srotas obviously along with that rasa and rakta srota dushti may be there. Then sira granthi is another lakshan for srota dushti. What is the sira granthi in case of uterus? It may be fibroid or formation of cysts. In this case, arthava srotas, rasa dushti, rakta dushti, along with that, mausa and medo dushti may be there. So we have to take detailed history of arthava srotas, rasavaha, raktavaha, mausa and medo examination should be done very properly. And what is vimarga gaman? Where the thing should not be, it is there. That cyst, the fluid cyst, where the rasa should not be, it is there. So it can be considered as vimarga gamana. So PCOS may be vimarga gamana, and which srotasa are dushta, artava and rasavaha dushti may be there. So this is how we have to take history of rasavaha, raktavaha, mausavaha and medovah srotas along with artavah srotas in case of whenever a patient comes to us. So after this basic consideration of srotas and types of vayu, we move further. Now, this is the aspect by Charakacharya. What Charakacharya has explained in Adhyaya of Sharira, Khuddika Garbhava Kranti Sharir is the Adhyaya where Charakacharya has explained about Matrujascha Garbha, Pitrujascha Garbha, Atmajascha, Satmajascha, Rasajascha, and Sattva. These are the factors which are responsible for formation of fetus. So Charakacharya has explained all these factors. We have to examine patient on basis of these factors or these bhavas also. Whenever we take a history or whenever we study the different patients, we find that the causes of infertility many a times lies in the ahar vihar of matru. That is, matru factor may be affected. what is Pitru factor? That is, of course, the uh, sperm count or motility of sperm. These all comes under the Pitruja Bhav, Shukra Dushti. Then Atmaja Bhav is the Chetana Dhatu, which is the most important for the formation of fetus. Then Satmyaja, the Ahar of Matru and Pitru is most important. The Satmya proper diet, then proper rasa is from. Rasa sahanana or rasa sampad is responsible for formation of fetus, and sattva and mana or linga there, they all are uh, playing a very important role in the formation of fetus. So we have to consider them while taking the case of infertility. Now the next point comes, which is most important. That is, Charakacharya has told us in Chikitsa Adhyay 30 that mithyacharena taha strinam दुष्टेन अर्थवेन च जायन्ते बीजदोषाच्च देवाच्च शृणु तः पृथक्. This is mithya achara of stree, that is female patient. The female is the one who is very important, who bears the child. So the fetus is going to feed on the rasa formed by the female digestive system. So the garbha is totally dependent on the female. After in the infertility also, the mithya ahar and vihar hetu of female is very much important. Mithya ahar and vihar hetu of female and their general health is very important, as they are one who bear child. So from this sutra, Charakacharya has shown how important the acharan of stree is. So nowadays we find that one female in five in India is almost suffering from PCOS. The prevalence of PCOD in India is 3.7 to 22.5 is what Google says. So this prevalence is increasing. So why this is increasing? This is because the lifestyle of females is also getting bad. They are also suffering from a lot of stress, then fast food, and extreme of exercise and no exercise. They are following extreme lifestyles. So this is most important factor in infertility. That is what Charaka has told us since very long, that mithyacharena taha srinam pradushtena artavena cha jayante bija doshacha. So bija dosha is formed because of faulty lifestyle of female. So we have to take a detailed history of daily dinacharya of that stree, which is most important. We have to take detailed history right from the Brahme Muhurte Uttishte. At what time the she is rising from the sleep, and what is her lifestyle as a whole, whether she has any stresses at office or family. We have to take the detailed history of her emotional background, so that we can check out and check out what is mithyachar if she is doing, and which is responsible for her bija dosh causing the infertility. So this is another very important background which has to be recorded according to the Charakacharya. From this sutra, Charakacharya has also thrown light on Daiva along with bija dosha. So what is this Daiva factor? That is also to be taken into consideration. I have seen many patients whose all reports are normal, when physical examinations are normal, investigations, then all sperm counts, even in female, the ovulation, ovum, everything is normal. But still, the infertility problem persists. Then it is destiny. We can say that Daivam Chatra Panchamam. This Daiva factor comes in. So, can we treat this Daiva factor? And what is the role of this? So in Ayurveda, the Daiva Vyapashya Chikitsa is also explained. So how this Daiva Vyapashya Chikitsa may be affecting on human body, So I feel it is the Manasa Bhava, Rasa and Prana Sambandha. As we all know that Artava and Bija has got impact by Rasa Dhatu. Prinana is the karya of Rasa Dhatu, and Rasa Dushti Lakshana has one Hetu which is called as Chinta. Chinta Yascha Ati Chintanat. It has been explained by Vimansthanin Charak. Chintayascha Ati Chintana is the Rasadustikara Hetu. Then the Chinta is also vitiating the Pranavayu. Indriya Dharana is the function of Pranavayu, and Manovas Rotas is also gets dushta by this Chinta. Mano Dainya, Mano Vaishamya are the symptoms which are expressed. So this mana sambandha, rasa sambandha and prana sambandha may be affecting the bija and causing infertility. So whenever the Daiva Vyapashra Chikitsa or whatever the beliefs or positivity the patient has, when you tell her to pray or perform some puja or mani dharan, mangalacharan, which has been explained as Daiva Vyapashra Chikitsa, we tell the patient to follow. It gives the positive vibes to the patient. This positivity is the positive manasa bhava, which cures or decreases the dainya or manovaishamya. So the chinta is decreased and rasa sampad is achieved. So this may be the importance of Daiva Vyapashra Chikitsa in formation of proper bija. So this is what I feel, and many a times so we suggest patients to start something like pranayam or yoga or puja or dhyan or whatever they like. This is because for the positivity of the manasa bhava, we know the mana rasa and prana sambandha. The gati of mana is of pranavayu. So these all go hand in hand. So emotional quotient, what we say, or emotional factor of a female, uh, it has to be cured positively. So Daiva Vyapashra Chikitsa may play role in that. So after looking at this background, we will see what Sahitas, especially Charak Samhita, Yoni Vyapad Adhyay, chapter 30. This is the Chikitsa Sutra of different Yoni Vyapad, Samanya Chikitsa Sutra, depending upon the dosha. So, Snehan Svedan Basti is Vata Pradhana Yoni Roga. Then Pitta Pradhan Yoni Roga, Kapha Pradhan Yoni Roga, and Sannipata Charakacharya has given this explanation. So we will take a review. In Vataja Yoni Vyapada, Snehan Svedan Basti is advised. So we have to see either it is Upastambhita Avastha or Nirupastambhita Avastha, and we have to consider Basti as the main Shodhana Chikitsa here. In Pittaja Yoni Vyapad, the treatment should be given acting on Rakta and Pitta is quoted by Charaka, Charya and Shitopachar. So what is the treatment on Rakta and Pitta? Naturally when Bahudosha Avastha is there, it is Virechan and Shitopachar. The Shita Dravyas are given. So these also may be either Swatantra Dushti or Paratantra Dushti. So if Margavarodha of Vata is by Pitta, it is Pittala Yoni, or we can say the symptoms of Pitta Vrutta Apan also can be diagnosed and treated. Then we move to Kafaja Yoni Vyapada. Ruksha and Ushna treatments are advised by Charak in that Chikitsa Sutra. Kapha Yoni Vyapad may be also Swatantra or Paratantra Dushti. Kafaja Margav to the functions of Apana especially. So it is Kafavrutta Apana. Ruksha and Ushna treatments, the drugs Ruksha or Ushna treatment we can give, but in case of Shodhana, when Bahudosha Avastha is there, we can also give Vamana here when patient is Arha of Vamana Karma. It is always natural that in Vata Pradhan type of disease, of any disease, we give priority to the Basti, Pitta, Virechan, and Kapha, Vaman. But the avastha of the patient should be studied well, Pachana should be given, then Bala and Arhata, Anarhata of patient should be checked, and then only, though it is written whether patient is Arha for it, C for it, and then go for Vaman, Virechan, and Basti in any patient. In dosha combinations, treatment depends on what is the involvement in the pathogenesis of Vandyatva. If it is dominated by Pitta, Anubandhi, Vata, Anuloman is proper treatment, because in Margavrodojanya Vata Vyadhi, the Anuloman is the treatment, and it is also good for Pitta. Likewise, we can think of the Shodhan which has to be given in Samsarga dosh. In case of displacement of yoni, snehana and svedana chikitsa is to be done, and relocation is to be achieved is written by Charaka Samhita, but nowadays it is done by Dhanvantari Adhikara. Even when a tubal block patient comes to us, we can give some treatments like Basti, but again it may be the Dhanvantari Adhikara. So we must know our limits also, limits of medicines and Shodhan also we must understand, and for the betterment of patient we should take the decisions and send the patient or refer the patient to a surgery. So let us move further now. So what are the Shodhan Chikitsas? Uh, in Purva Karma, Mrudu Snehana Svedana is given. Then Vamana, Virechana and Basti can be administered, as we uh, see in the previous slides. After Shodhana, the rest of treatment should be given like Shamana, then Rasayana to be administered. This is in short the background of treatment and the background for Nidana, which till now, till this slide, we have seen and considered for diagnosis of and Shodhana treatment. So diagnosis should be based on these all background, and Shodhana treatment should be given accordingly. So now let us move to the objective of the today's protocol. So the protocol for Vandhyatva Chikitsa in our case paper, whenever a patients come to us, is of 5 steps. What are those steps? Let us discuss. The step one is the general examination. This is the first visit of the patient to our OPD, where we take detailed history. Then step two is to find whether the patient sitting in front of us is of Santarpanjanya Avastha or Apatarpanjanya Avastha is the most important second step. The step three is to identify whether the patient is of Sama condition or Nirama condition, and which dosh is dominating the pathology. Then the step four. Step four is the four factorial examination, which has been explained by Sushrutacharya, Rutu Kshetra and Ambu Bija. And the step five is by Charakacharya in Khuddika Garbhavakranti, that Matruja, Pitruja, Atmajadi Bhavas Pariksha is the step 5. So all these 5 steps we have to incorporate in our protocol of infertility case paper. So let us see one by one and understand these steps. So moving to step 1. So the step 1 is the detailed history taking. So the first visit of the patient. According to Ayurveda, from very first year, we have always learned in our journals also that Ashtavida Pariksha is most important in history taking. So we do Ashtavida Pariksha, which is explained by Yoga Ratnakar. What are the factors? Nadi, Mala, Mutra, Jiva, Shabda, Sparsha, Druk, and Akruti. So they give us knowledge about the different status of the patient. So what do we understand by Nadi Pariksha? We understand the Nadi Bala, so a status of circulation, then predominant dosha, Nadi may be Vata Pradhan, Pitta Pradhan or Kapha Pradhan. So current status we get. that currently in the patient's body, the pitta is dominating as the nadi is of pitta pradhana avastha. So by nadi, we understand the current bala pariksha and current dosha pariksha. Then after nadi is nadi, mala and mutra. So mala and mutra gives us the status of agni, how the metabolism is working in the patient, and it gives the picture of sama and nirama avastha also. And if bahumutrata is there, then it leads us to write the further investigations like sugar, BSL, everything. We get that guidance from mala and mutra pariksha. Then Jivha Pariksha, the most important. It again gives the status of Annavasrotas and whether patient is suffering from Samavastha. From Jiva, we understand that Pachan has to be given or not. This treatment guideline we get from Jiva. Then Shabda of patient again gives us the picture of dosha, and again Bala of Udana and Prana. So this Shabda Pariksha is also important. Then Atura Shabda, we understand that how much in pain the patient is. It may be emotional also. Then Sparsha Pariksha, Shita or Ushna. Uh, Shita and Ushna gives again the dosh predominance to us of the Sparsha. Drug and Akruti. Akruti, whether patient is Santarpanjanya or Apatarpanjanya, that step we understand by Akruti. Whether patient is Sthula, Shithila, whatever the observations is by Akruti. And Druk. Drushti Pariksha is most important. The uh, the famous quote in Bollywood that nazar sab keh jati hai. So we understand even the emotional background of the patient by its drushti. So this is the importance of Ashtavida Pariksha. Then comes the role of Dashavida Pariksha. So Dashavida, there are two types in Vimansan, Dashavida Pariksha Bhav and Dashavida Pariksha. So Dashavida Pariksha is Prakrutitaha, Vikrutitaha, Sara, Sahanana, Pramana, Satmya, Sattva, Ahara, Vyayama Shakti. So Prakriti of female patient, which is the basic Prakriti, is Vata Prakriti is a reason for irregular cycles, Rukshata and formation of bij. We have to find out from Prakriti. Vikruti Parikshan, what exactly, which srotasas are Vikrut, we have to see. Then Sara, in Rasa Sara, in Rakta Sara, there are different symptoms. So we have to find the Saratva. Then Sahanana, whether patient is Krusha or proper Sahanana is there. So Mausa Bala and all these kind of things we can understand from Sahanana. Then Satmya means we take the detailed history of her ahara. Sattva is her emotional quotient can be checked. Then ahara shakti and vyayama shakti. This vyayama shakti is most important nowadays because many are going to gyms and extremely workout they are doing than ardha shakti vyayam. So this may also cause unnecessarily apatarpan and agni dushti, and maybe the cause of infertility. And not doing anything, merely ideally sitting, work from home is also another problem. Kafava rodh and santarpan excess may be found. So this ashtavidha and dashavidha pariksha of the female patient or male any patient, but in here the patient of infertility has to be done properly. Then comes the Srotas Parikshan. We have the format in our case papers, the detail of Srotas Parikshan. So, especially as we have seen in the background, Mausavaha, Medavaha, Rasa Rakta, and Artavaha Srotas, Annavaha, and Pranavaha Srotas, and Monovaha. They have to be examined thoroughly. What else we take in step 1? Present problem, history of present problem. Then family history in detail, because family stress is also rising in females, because uh, they are working in their job place, and they are also working at house, and they have stress, pressure nowadays, a lot of pressure. So hormonal imbalance is the main cause of infertility due to this stress. So we must know their family history, their work history, then genetic, and this daiva vyapashra history means whether they are doing any pranayam yoga or any philosophic dhyan pujan, we should take in account that also for their manas bhav. And then general examination, investigation reports. Nowadays the infertility patients come with different reports like ovulation studies and hormonal assays. We have to note down these investigations and reports very particularly to come to our conclusion. So step 1 is very crucial. This is the first history taking of the patient, and findings on the examination of this first step led to the further steps, which shodhan has to be done, how it is to be done, whether pachan has to be given or not. So step 2 and step 3, what are they? Whether the we have planning for shodhan, first see whether patient has santarpan janya avastha, then we can plan shodhana. So how to find that patient is santarpanjanya? We can calculate BMI. When body weight BMI is raised and bahudosha avastha lakshana is there, you can make a checklist for this bahudosha avastha lakshan. When this bahudosha avastha lakshan along with raised BMI is found, we can say that patient is of santarpanjanya and shodhana has to be administered. Then see whether patient has got samavastha or niramavastha. If patient is of samavastha, pachana and shodhana has to be given, and in niramavastha we can directly start the purva karma, pradhan karma for shodhan. If patient is of apatarpanjanya, means vata pradhana dushti, then body weight and BMI is low, rukshata is there, then Shodhan should not be administered. Bruhan and Tarpan should be given. But in Bruhan, we can give the Yapan Basti or Kshira Basti or Sneha Basti also. If they also have Samavastha, again first give Pachan, then Tarpan, then Bruhan. And Niramavastha, directly Tarpan and Bruhan treatments can be given. Now the step 3 on the basis of dosha. Uh, so differential diagnosis and the treatment of dosha, sama dosha, nirama dosha, and which is the predominant dosha we have to find. So vataja symptoms of yoni vyapad are toda, vedana, stambha, pipalika sanchara, uh, karkashatva, supti, and other vata pradhan symptoms. So when we find these vata pradhan symptoms, we have to give snehan, svedan, and basti. As a priority, the shodhan for these symptoms which we have to choose is basti. But in samavastha, first again we have to give pachan. This step is most important for agni chikitsa, as shodhana chikitsa should not be given in samavastha. Vagbhatacharya has said, Sarva deha pravisrutan saman doshan na nirharet. So, examination of pulse, tongue, aushna, dardhya, we have to find out whether it is samavayu. Then we have to give pachan. Now, in case of pachan drugs also, the same pachan drug can we give for all kind of ajirnas or samavastha? No. When it is samavayu, the lavana rasayukta pachana dravya has to be given. Uh, Here we can administer at samana kala the bhaskar lavan churna. If we have to administer hingvashtak churna, if kafanubandha is there, but it should be given along with gruta. So amla dravya is also can be given for vataja samavastha. So after pachana is given, when jiva is niram and nirama lakshanas are there, we can give snehan, svedan, and basti. Then when pittaja symptoms are there, like daha, paka, ushna, jivara, uh, artava, daurugandhya, nila, krishna, varna, artava, and other pittaja symptoms, we can diagnose that the patient is suffering from pitta predominance. So for her infertility, we have to give the pachana for pitta. Here tiktaras is given. So tiktaras has to be given as pachan for pitta, guduchi or patola, then Soot Shekhar, whatever the Tiktaras dominating drugs can be given as Pachana. Then Raktavaha Srotas has to be taken into consideration, and in Bahudosha Avastha, Virechan has to be administered. After Virechan, Shita Chikitsa is given. Shita Chikitsa, which rasa? Madhura rasa dravya has to be given for Shita Chikitsa. And Tikta is also Shita. In Niramavastha, we can directly give uh, the Rakta Pitta Chikitsa and Shita Chikitsa as advised by Charak Samhita. Then we move to Kaphaja symptoms. Yoni Pichilata, Shaitya, Kandu, and other Kapha symptoms. Again, first Pachan has to be given if Samavastha is there. Rukshan, Pachan, and Aushnya. So Katuras and Kashaya Ras Dravya has to be given. We can give Rasonadivati, Chitrakadivati here in Kafaja Avastha. And when Bahudosha Avastha symptoms are also seen, Vamana can be given. And after that, Ushna Chikitsa is given. In Nirama Avastha, Rukshan and Vaman and Ushna Chikitsa. So this is how the dosha symptomatology and shodhana is to be recorded and done. Now the step 4. The step 4 is of Sushrutacharya examination of other factors. That is, there are 4 factors. One is kshetra. So whenever again we talk of kshetra, it is the anatomical structural findings. The USG findings to be noted in here. So in Kshetra also, the Vyuhakara dosha is Vata. And the cycle or the Sharira is again dominated by Vata Chikitsa. Sarva Sharira Dhatu Vyuhakaraha. It has been told by Charaka. So we have to consider the Vata Chikitsa, that is Snehan, Svedan, Basti and Anuloman for the proper function of uterus. Then based on USG findings, we have to decide what kind of shodhana has to be given. If there is PCOS in the uh, USG finding, for PCOS, the Bhedana is the proper treatment. It may be daily Bhedana Chikitsa. Bhedana Dravya can be given daily at night, or in the morning you can give the Pachana Gruta. In the night, we can give Bhedana as a routine to avoid this PCOS. So, Vata Chikitsa is there for Kshetra also. Then we see the uh, Rutu. So, Rutu is the cycle. So, ovulation study, follicle study, all that comes under the Rutu Pariksha. Again, it is the set of a cheshta, chalaguna. So, Vata Chikitsa comes. Here, we have to do Deepana, Pachana, Anuloma, the Bhedana, and Basti. So, in consideration of Rutu, there are 2 steps. One is hormones, Manasa Bhav, that is Pranavayu, Indriya, and Bija Nirmana. So, for this, if ovulation is not proper, cycle is not proper, and there is some hormonal imbalance, we have to give Nasya and Shirodhara as a priority before Shodhan. So, Nasya and Shirodhara should be given, and after that, Deepan, Pachan, Anuloman, Bhedan or Basti has to be administered. Here, Vyanavayu and Pranavayu, both we have to consider. We can find PCOS. So, um, this is the Sanchaya Pradhan Dushti. So this Sanchaya Pradhan Dushti, again, Shodhan is very important. To prevent this also, routine Shodhan is also important. So we can give Snehapan, then after Pachan Snehapan, and when Pitta predominance is there, Virechan for Kapha Vaman. After Virechan and Vaman, we can give Basti for regularization of the cycle and prevention of this PCOD. So Vaman, Virechan, and if we find that Vata is only predominant, then no need to give Virechan, Vaman. We can directly give the Basti. But Anuloman is most important, so that there is no Margavrod of Vayu by Pitta and Kapha. So daily Anuloman also helps in the PCOS. So these kind of Sharangdhara has told uh, Srausan Chikitsa Anuloman Rechan and Bhedan. So Sharangdharokta Virechan, the four types, the drugs can be used on daily basis, which gives success in these patients. Now another is non-maturing follicle. So if bija is not getting proper rasa pridana, uh, then if there is lack of nutritional diet, non-maturing follicle may be there. So here we can diagnose this as apatarpanjanya avastha, and in vata pradhan patient this may be found. So we have to give balya bruhan and tarpan chikitsa. What we can give is anuvasan, yapan, ushna and madhura dravya, and after that for vatanuloman and bhedan, for rupturing we can give tikshna and katu dravya. So this is how for shodhan we have to think about different avasthas and predominance of dosha, types of vata, pitta and kapha. Moving further, uh, now it is ambu. So in case of ambu, रस and रक्त, रसव स्रोतस दुष्टि and artava kshay. So if there is lack of nutrition, the artava kshay may be there. It may be related to the stress, rasa dushti, as we have seen earlier. The chinta may be the uh, problem or cause. So here we can give snehan, svedan, yapan and bruhan bastis for proper nutrition of that female. And even for stress relieving we can give shirodhara, nasya and shiropichu or murnya tela. Different kinds of murnya tela, ashwasan chikitsa, counseling can work here uh, in this ambu factor. Then after Rasavasrotas, Raktavasrotas, Jivan is Karya of Raktavasrotas. In case of Pradar, Deepan, Grahi and Stambhana drugs we have to give. Tiktaras for Pachana, then Virechana. Uh, Pratimargam cha Haranam Raktapittam Vidhiyate is the sutra. Pradar can be considered as the Adhoga Raktapitta. So we have to consider and go for Vaman if patient is Arha. Then chikitsa according to the Sama and Niramavastha and Dhatvagni of Rakta we have to treat. But when it is Raktakshay or Pandu, we have to give Rakta Poshaka Chikitsa to the patient. Uh, that is all Mandur and all those uh, drugs should be given. And after that, when HB is correct, then we can give Vaman, because in Durbal patient, we cannot give the Vaman. So we have to be careful while conducting the Vaman. Now coming to the Bija part. So Pradushta Artava. When Apatarpan Avastha is there, Bijaksha is there, non-maturing follicles. So Ahara Vihara and Pathya Pathya of the patient has to be advised. Then Agni Dipan, Bruhan and Yapan Basti can be given. We often practice Trutiya Baladi Yapan Basti, which is Artava Bruhan. And Margavrodha Avastha, non-rupturing due to Srotorod, Lekhana Basti, Tikshna and Katurasa Basti can be administered here. This is how the bija has to be treated. Now we come to the step number 5. That is the last part of our protocol. Advice for healthy conception, consideration of bhavas, interpretation and treatment by Charak Samhita. So, Matruja, that is female factor, body constitution of prakruti of female, as we have seen in Dashavidha Pariksha, Prakrutitaha Pariksheta. Then general health and nutritional status and condition of the female should be taken into consideration. Systemic diseases, if a female has, it has to be also taken into consideration. If some patient has come to us, we often find that the patient is having allergic rhinitis. The patient has come to us for infertility treatment, but she is suffering from allergic rhinitis. So we have to first consider her systemic problem, that is allergic rhinitis. So allergic rhinitis is showing that she has got some problem with kapha. This kapha may be predominantly becoming the cause of her infertility, because uh, this kapha dushti may be related to the rasa, then agni, then formation of artava. So do not ignore any systemic disease the female suffering from. So we have to first consider what systemic disease she has, and we have to treat along with that. So shaman chikitsa for a systemic disease has to be given, and then shodhan chikitsa for that disease if she has bahudosha avastha. And for healthy conception, rajo shuddhi should be there. So all this systemic disease has to be considered and treated very well. And nowadays the concept of supraja is very much in, and preconceptional shodhan. A lot of patients approach us nowadays. They want to get conceived, and so they want body to uh, purify. So they come to remove the toxins from their body, and they need the shodhan chikitsa, and they feel that very important. So for this supraja also, patient has to be given shodhan. When patient has no any systemic disease, we can uh, give vaman virechan basti uh, in alignment. But first find out what prakruti the female has, and whether really woman and virechan uh, is required, or woman is required only virechan is required. Find out that, and do it accordingly. Then the pitruja bhav, that is male factor. Body constitution of male, that is prakruti, then general health, nutritional condition, and systemic disease of male also we have to treat. Again, like female, shaman and shodhan chikitsa for diseases whatever he suffers from. For shukra shuddhi, we have to give the treatment. For males also, we give the trutiya baladi yapan basti. For healthy conception, balya and vajikara treatment should be given. First, the metabolism and pachan and agni should be cured. See whether he has some vyasanataha alcohol or tobacco chewing. Advice to stop. Or if aushna is there, excessive aushna is there, it may lead to the depletion of shukra. So we have to treat the patient by yapan basti or bruhana basti after taking care of this excessive aushna and amla. The chikitsa has to be given depending upon the prakriti of the patient also, for suprajanana before conception. Then let us move further. Atmacha bhav, that is Chetana Dhatu Linga Deha. Here the Daiva Vapashray Chikitsa, Pujan, Mani, Mangal, whatever they feel nice, and emotional quotient is maintained, we can suggest them. Parashara Samhita tells a lot of about this Daiva Vapashray Chikitsa. You can go through. Then Satmeja, the formation of Rasa and Rakta Sampada Dhatu. So whatever Satmya Ahara, that only should be taken. Going to gym and eating lot of curds, yogurt, then whey protein, which is not digestible, and if that is causing the metabolic disorder, we should take detailed history and tell to take whatever Satmya only. Then rasaja, as we know, rasa is very important as it is related to artava. The nutrition should be checked. If agni is not working properly, dipan, pachan, then shad rasatmak ahar, balanced nutritional diet, tikta madhura, and yapan basti also can be given for rasa sampad. Then satvaja, that is psych, mental health treatment, achara rasayan, ashwasan chikitsa. And if a patient has stress, nidra nash, then nasya and murna tela shirodhara can be given. So this is how the charakacharya matruja pitruja bhavas has to be taken into consideration in our protocol. So this is the 5 step protocol as we see. So now uh, we come to the discussion part. As conception is a combination of different mental, physical, destiny factors, consultant must take in account all these factors. If this protocol is followed and a detailed case history is taken, the probability of missing out anything in diagnosis and treatment of Vandyatva will be reduced. This is the model protocol. On the basis of this, by using Yukti Pramanya, all very intelligent Vaidyas in front of me online can make their own special protocols according to the basic principles. The basic principles by Sahitas is the same. The Madhura Rasa is going to be act as Bruhana. So when patient is of Apatarpan, you should give the Madhura Rasa, but before that Agni or Kaya Chikitsa is most important. So these principle we have to follow. Don't forget these principles, and protocol should be dependent on these basic principle of our Charakacharya, Sushrutacharya and different Sahitas. By using different Sanhita, you can make different protocols. So this is a just model protocol effort from me. After checking the different infertile patient, I have come to this discussion with you. So in summary, let us see, whenever a infertility patient comes in our OPD and sits in the front of us, the step one was to take the detailed history and to diagnose whether patient in front of me is of Santarpan Avastha or Apatarpan Avastha. If you find the infertility patient is of Santarpana, then Langana or Shodhana Chikitsa has to be given. If Apatarpana, then Bruhan and Yapan has to be given. This Yapan and Bruhan is can be Basti. Basti vate cha pitte cha kafe chapi shasyate. And as it is the predominant is Vayu, and Basti is the Sreshta Chikitsa for Vayu. And Nahi Vatad Rute Yoni Narinam Sampradushyati. So Basti is most important treatment for Bruhan also, for Langan also. Then if Samavastha is there, Pachana has to be taken into consideration. Agni Chikitsa has to be done. We have to find at what level the Samata is there. At Srotas level, uh, Dhatavagni, then Bhutagni or Jatharagni. We have to give drugs accordingly, and when patient is after Pachan comes in Niramavastha, then only we have to give Shodhana. Then we have to find out Doshaja Samprapti according to the Chikitsa Sutra of Yoni Vyapada by Charakacharya. Then Sroto Dushti should be taken care by Srotasha Chikitsa Sutra. Then after that, for Kapha Pradhan, you can give Vaman, Pitta Pradhan Virechan, and for Vata Pradhan Basti. Then also consider Rutu, Kshetra, Ambu and Bija. The structural and functional review, investigations, USGs, and treat the patient accordingly uh, by finding out from the investigation which is the dominating dosha, which is the Sroto Dushti. The investigations like USG are Pratyaksha Praman, uh, as Pramana, Anumana, all they give the detail eyesight to us. So this is the Pratyaksha Praman. The investigations are Pratyaksha Praman. We have to use them. Then Matruja, Pitruja, Satya, Satma and Atmacha Bhava. Preconception, Supraja treatment, they are very much useful. So we can give this treatment the couples which come to us for detoxification of body for the conception. So this is the summary of the protocol. So the conclusion is systematic protocol is developed for complex problems like Vandyatva will be helpful in our clinics. Ayurveda basic principles uh, when followed stepwise, the probability of success increase. So this is the conclusion, and I hope you all will now uh, make different protocols in your clinics. So I'm thankful to you. Thank you. I'm thankful to RAV for giving this opportunity in one third webinar, and I'm thankful to organizers, thankful to Ministry of Ayush, all respectable gurus, all directors, and I'm very much thankful uh, to you all who are listening to me online. Then I'm also thankful to my department of Panchakarma, my PG students, my faculty of Panchakarma. Then I am thankful to Secretary and Principal of Sumati Bai Shah Ayurved College, as well as Sane Guruji Arogya Kendra, where I work. I am also thankful to Gokhale Ayurved Clinic and Dr. Vivek Gokhale, with whom I work. And thank you, everyone.
मैडम बहुत बहुत आपको धन्यवाद, बधाई। आपने बहुत अच्छा ज्ञान जो है गहराई से लोग हमारे छात्रों को दिया, हमको दिया। हम बहुत बहुत बधाई दे रहे हैं आपको। ईश्वर से प्रार्थना करते हैं कि आप इसी तरह से हमारे कार्यक्रम में लाभान्वित करती रहें। आगे भी आपको पुनः इस कार्यक्रम के लिए आमंत्रित करें। बहुत माया जी, बहुत बहुत बधाई और धन्यवाद आपके सुंदर व्याख्यान के लिए।
Thank you, sir. Thank you so much, ma'am. I think we can take some questions. Participants, if anyone is having any doubt, ma'am is ready to answer that. You can raise your questions, please.
चेतन में कुछ बोलना है?
If there is any doubt regarding anything, you can raise your hand and you can ask ma'am. Or if anyone wants to share their feedback, you are free to share that. I think we can wind up the session. So first of all, thank you, ma'am. Thank you so much for such a wonderful explanation on the provided topic. So now I'm presenting formal vote of thanks. Good evening once again, everyone. It's an honor for me to present formal vote of thanks on 113th webinar Gyan and Ganga Knowledge Week, a webinar series organized by Rashtriya Ayurveda Vidyapit, New Delhi. On behalf of organizing committee, I want to express my humble gratitude to the respected guest speaker of the day, Professor Dr. Maya Gokhale, ma'am, for such a wonderful explanation on the topic, diagnosis and treatment protocol for Shodhana Chikitsa in Vandyatva. Ma'am, thank you so much for such an excellent explanation on the topic. It was more special, I think, because it popped out in the season of Navratri, and we can see many Shaktis. They have joined us live from the different parts of the country, and it was so special.
Thank you.
Yes, ma'am. It became more special because you mentioned Chintash Ati Chintana, that how mental health plays important role in conception and Vandyatva. And you too, you have touched male infertility also, that how it is important to work on both the factors, not only on female, but for male part is also very important for us. So thank you so much for throwing light on the different aspects of this. Now I would like to pay wholeheartedly gratitude to respected Padma Bhushan Vaidya Shri Devendra Trigunji sir, governing body RAV, for his immense contribution and encouragement. I express my humble gratitude to Vaidya Manoj Nesri ji sir, advisor Ayurveda, Ministry of Ayush, for his blessings. I extend my heartfelt gratitude to Dr. Kaustubh Upadhyay sir, Director RAV, Advisor Ministry of Ayush, for his immense contribution, guidance, and all the efforts that he has put forward. And I must thank the organizing team of RAV and all the volunteers who worked behind the scenes for tremendous efforts to make this webinar a grand success. I also thank all the respected Gurujans and participants who connected to us from the different parts of the country in spite of their busy schedule. Thank you, everyone. And now, speaker and the topic for the next webinar will be shared with all of you very soon. Till then, take care and good evening. Thank you so much, ma'am, once again.
Thank you. Thank you. Thank you, everyone.
The webinar is over, so you can leave the meeting. Thank you.